I certainly want to talk with you a little bit more about the preparation, because we hear a lot about that. But how often should someone be screened, and do we have agreement now as to what is the best screening protocol?
Yeah, I think unequivocally, from a cost standpoint, from a effectiveness standpoint, people believe that colorectal cancer screening with colonoscopy, that is the gold standard. But what we tell people is any screening test and protocol you follow is the right one. If you don't do any of them, that's the wrong choice. So, and people have personal choices with those. So we want people to exercise that. We want healthcare professionals and providers to have that discussion. Because if you're afraid of one test, well, then we've got another test that we can help you with.
Sure.
But we know that the benefit of colonoscopy occurs that day, whereas many of the tests like fecal occult blood, testing for blood in the stool, that takes years and years and years to see a true benefit in terms of reduction from colon cancer.
So what seems to be coming out of our conversations, for those who are watching, colonoscopy is the gold standard. That's what you really want.
Absolutely, and I think anything less than that is still a great test, but if it's positive, it's important that they know that that will lead to a colonoscopy. And one point, 1 out of 4 people have colon polyps over 50.
1 out of 4.
1 out of 4 are walking around with polyps in them right now. And which of those will eventually turn into colon cancer, we can't tell at this time. But we know if we remove those polyps, people don't get colon cancer for the most part.
So if this is such a curable disease, preventable disease, curable disease, and it doesn't seem to be very difficult to do it, why don't more people do it? What are the barriers that are keeping the general population from just rushing out and saying, I need to make sure that I've had this done because I'm in the right age group or I have the right risk factors?
Right. Well, and you're absolutely right, first of all. Over 90% of colon cancer deaths can be prevented with appropriate screening. That's almost vaccine numbers.
Say that again.
90% of colon cancer deaths can be prevented with colonoscopy as the primary screening tool. The other screening tests are somewhat less, but looking at the gold standard, 9 out of 10 of the almost 1,000 people in Kentucky who die every year don't have to die of this disease. What are the barriers? Well, I think the first barrier as a healthcare professional is we're still not doing a great job of systematically asking every single patient when they walk in through that door. We do it with blood pressures. We always take a blood pressure. But with regards to cancer screenings, you know, breast and cervical are pushing 75–80%, which is about as high as we can get. But we're not systematically asking that question. Number two, so that's one barrier, that is the healthcare profession. Number two, there's a yuck factor involved with this. People see this prep and they've heard horror stories from the past. The preps now are easier and more simple than ever, but they still require a cleansing of the bowel. You can't get over that. Another barrier is people have a hard time when they're asymptomatic, feeling good, not having any problem, need to take a day off of work, and at the end of that great story, they get a long, slender tube up their bottom. That's a hard sell. So we have to do a better job of making sure that people are aware of the importance of this, and that this single day out of their life, every 10 years,
every 10 years,
every 10 years for a normal risk person is a small price to pay, considering this disease will affect 1 in 17 people over the age of 50.
We're running short on time, but I certainly want to talk with you very briefly about how long the test takes. Why is it difficult to do? Is there anesthesia required? How quickly can you go home? Those just very gritty, matter-of-fact questions about the colonoscopy test itself.
Right. Generally, a person can get prepared for the colonoscopy the day before the test, and you can still go to work. We ask people to be on a clear liquid diet, and then towards the end of that day or the middle, they'll start drinking some medicine or taking some pills that'll actually cause them to have, you know, cleansing of the bowel. You'll have a lot of bowel movements, you'll get cleaned out, and then we can see. The next day, a person shows up. Most of the time, not all the time. If someone requests no anesthesia, we won't do it, but I'd say 98% of people get a little bit of conscious sedation, which means they're sort of in a dream state. People don't remember anything. The test itself takes anywhere from 15 minutes to 20 minutes, depending upon who does it and how hard it is, and that includes removing polyps while we're in there. People go home the same day after about an hour of waking up. They're able to essentially do most of their activities of daily living, but we recommend no legal decisions, no machinery operation. And then the next day they're back at work. So this is truly, if people change their oil and change their furnace filters, see the value of mammography and pap smears, this clearly needs to get into that mode, both your personal and your health life.
And it seems that if the doctor doesn't ask, the patient ought to know that I'm in the right age group or I have a family history, so I should ask my doctor these questions. Just real quickly, just on those two issues, age and family history.
If you have a family history of colon polyps or colon cancer, as well as some other cancers like early ovarian or uterine cancer, you need to be checked at least 10 years before your brother, sister, father, or mother was checked. So that's very important. A family history moves you up. But if you're of normal risk, walking around there, playing basketball, having fun with your kids, going to work, age 50 is the time you need to be screened.
Okay.
And it's a very important test, and one we hope that our Louisville audience won't put off.
I really want to thank you for being on. It's been great to have you here, and I want to thank you for being on Health Matters. And those who are watching, please, please, please take care of yourself, think about colon cancer, and get the right prevention and messages done.
Very good.
Thank you.
Very good. Thank you.